Hi there, I'm Marlene Moster from the Glaucoma Department at Wills Eye Hospital, and I'd like to talk to you about glaucoma surgery. 80% of glaucoma can be controlled with either lasers or drops. When the pressure is uncontrolled and the visual fields get worse, we often recommend glaucoma surgery. What does that mean? With glaucoma, the drain in the eye is not very effective, so it does not filter the fluid that the eye makes. As a result, the pressure goes up and it squeezes the nerve so it starts to die. That results in visual field loss, as you see here, when the vision and the pressure are not perfect. Oftentimes, your vision will be affected by the way the visual field starts to constrict. And when your doctor notices a change in your visual field, oftentimes a trabeculectomy is what is recommended. This is a surgery which makes a new drain in the eye. It makes a flap in the white part of the eye called the sclera. A piece of the drain is then removed so that the fluid made inside the eye goes through this new opening via a path of decreased resistance. It forms a bleb, B-L-E-B, which is a reservoir on top of the eye at about the 12 o'clock position. The lid covers it so it's not visible to anyone looking at you at that time. However, the bleb or reservoir collects the extra fluid that the eye is incapable of draining so that the pressure comes down. Normal pressure is 10 to 20. Sometimes the pressures are excessively high. Sometimes, in cases what's called normal tension glaucoma, you can even lose vision when the pressures are not excessively high. It's up to your doctor to decide what is the best pressure for you, and if he or she recommends a trabeculectomy, we often like to see the pressure come down around 50% if possible. This can be accomplished by surgery. It is painless, however, stitches are needed in order to assure the success of this procedure, and they are removed slowly with the doctor's advice over time in the office. Trabeculectomy has been in place since the early 1960s. It is one of our most successful procedures for lowering the intraocular pressure. Oftentimes, patients do not need medications following a trabeculectomy. The vision is restored, the optic nerve remains at its best health, and the patient does well moving forward. I hope this information is helpful to you. Thank you very much.